Welcome everyone. Good evening and welcome to this Henry Schein webinar on renal and urinary disease management for feline patients. My name's Rachel Cook and I'll be hosting tonight's webinar, which is sponsored by Oralaid. Presenting tonight will be Oralaid's extremely knowledgeable medicine specialist, Christine Bastholm-Jensen. So Christine is going to be outlining the best practice management approach to the feline patient with renal or urinary disease, with a special focus on supportive therapy for chronic kidney disease and feline lower urinary tract disease. Christine will also be discussing other indications for the use of Oralaid oral rehydration support in the feline patient. Just before we start, can I just point out a few ways in which you, as the listeners of this webinar, can you submit your questions to Christine as you listen along. So if you just look to the right-hand side of your screen, you'll see a few drop-down options, including the option to ask a question. So feel free to submit your questions to me at any point during the webinar, and I will try to put as many of these to Christine during the last 10 minutes, as many as possible. So if we don't manage to answer your questions tonight, don't worry, these will be answered via email after the webinar is finished. And if anybody has any issues with sound, or just use the chat option again on the right-hand side, or raise your hand by pressing the hand icon. And I'll do my best to solve this. Okay, without further ado, I'm going to hand you over to Christine. There'll just be a moment's pause whilst her presentation is set up, so bear with us. Okay, take it away, Christine.
Thank you very much. I hope you all are able to hear me. Thank you for the kind introduction to this evening's webinar, which has the topic oral hydration therapy in feline lower urinary tract disease and chronic kidney disease. I'll have a special emphasis on the use of Oralaid in cats. For those of you who may not be familiar with Oralaid, it is the only veterinary registered product on the market which is specifically formulated for oral hydration and microenteral nutrition in cats. And as Rachel said, please do feel free to type any questions you may have into the questions chat box. I will not be answering the questions during the presentation, but I have set time off to answer them at the end. And this webinar would not just be about Oralaid, but about the concepts of managing cats with a particular focus on feline lower urinary tract disease and chronic kidney disease. Right. So to give you a brief overview of the presentation tonight, we'll start with an outline. And the purpose of this webinar is to give you a brief overview of two quite large disease complexes, both of which I could spend a lot more time to talk about. But I have tried to keep the focus on management rather than excessive background information, pathophysiology, etc. So to start with, we'll talk about feline lower urinary tract disease, just briefly go through the causes of this syndrome, and then focus on management of feline idiopathic cystitis, also referred to as FIC, and discuss a bit about the difficulties of increasing water consumption in cats and general water requirements in cats. And then we'll move on to talking about chronic kidney disease in cats, briefly about the definition, and then focus on aims of therapy and our current management options with this disease. To start out with, feline lower urinary tract disease, generally referred to as FLUTD. It's an umbrella term for different types of diseases affecting the lower urinary tract of cats. They're all characterized by clinical signs like hematuria, pollakiuria, stranguria, and pyuria. It's quite common in general veterinary practice. There's an American survey looking at all consults and the reason for cats presenting in general practice, and almost 5% were related to the lower urinary tract. And moreover, it's a disease where recurrence is common. There was a Swiss study looking at male cats with urethral obstruction, and about a third of these cats experience recurrence. And the risk of a recurrence have important welfare aspects, as it is obviously causing pain and stress for the animal, but can also be quite stressful for the owner of the pet, both from welfare perspectives, but also financially, as veterinary care can be expensive, and obviously may finally lead to euthanasia of the cats. So here is a list of the causes of feline lower urinary tract disease. The majority of cases is caused by feline idiopathic cystitis, referred to as FIC, with approximately 50% of cases caused by idiopathic disease. Then the next common cause is urolithiasis, with the majority of cases being caused by calcium oxalate and struvite uroliths. Although these represents approximately 50% struvite and 50% calcium oxalate uroliths, the majority of urethral plaques causing obstruction are struvite plaques or struvite uroliths, nearly 90%. Anatomical defects, 10%, behavioral, 9%, neoplasia, quite uncommon. And urinary tract infection is also quite uncommon, which is important because I think it's a disease that's often misinterpreted for being a bacterial cystitis with the presenting clinical signs. And it's really quite important to know that this is uncommon, and it's more common in older cats, or cats with that had a urinary tract procedure, like catheterization. So feline idiopathic cystitis is characterized by relapsing episodes of hematuria, polyuria, stranguria, and pyuria. The signs often spontaneously resolves within 4 to 7 days without any treatment. The underlying cause for this disease, or this syndrome, is still unknown. And although our understanding of the pathogenesis has improved over the past 10 to 20 years, the underlying cause is still unknown, which means that we also lack specific therapy for the condition, and there are limited evidence for effective therapy. So the main goals of therapy for this disease is to decrease clinical signs and increase the interval between episodes. So current recommended standard care for FIC includes environmental enrichment, stress reduction, and I'm not going to go into more detail with this. It can be looked up in textbooks, etc. We'll keep the focus on increasing water intake, which has been proven. There's indirect evidence in clinical trials where it appears like decreasing the urine-specific gravity of cats with FIC decreases the clinical signs and increases the length between recurrent episodes. So additional therapies that may be indicated are analgesic therapy during acute episodes, because obviously the cat does experience pain during this inflammatory condition, and possibly the use of glycosaminoglycans or amitriptyline, which has both been described as sort of third measures of therapy if the recommended standard of care is not effective. So coming back to increasing the water intake, this is also where the use of oral aid comes in, as this is a palatable oral hydration therapy that can be used in cats. So cats with feline idiopathic cystitis tend to be fed significantly more dry food than cats without FIC. However, that doesn't prove that dry food consumption is causing FIC, but is thought to be a predisposing factor. And there are 2 studies supporting that decreasing the urine-specific gravity from 1050 to around 1030 definitely reduce the recurrence of FIC in patients. And other potential benefits of lowering the urine-specific gravity, diluting the urine, is reducing the concentration of urinary solutes, reducing urinary osmolality, and increasing the urine volume, so sort of flushing out any debris or inflammatory material. So this leads us back to water requirements in cats, because cats' water intake is difficult to regulate, as cats do not normally drink much water. They are evolved to obtain their water requirements almost entirely on the moisture contained on their food. So normal cats eating rodents or birds, or house cats eating canned-only foods may obtain enough water in their diet so that extra drinking water may not always be needed. They are also slower to initiate drinking or to drink enough for complete hydration, rehydration when they are dehydrated. A cat consuming a predominantly dry food diet will drink more water than a cat consuming a canned food diet. But in the end, if you look at a total sort of water consumption in these 2 groups of cats, cats that are fed only dry food do not increase the amount of water drunk enough to fully compensate. So obviously a wet diet again comes into picture, but also trying to increase the water consumption in any other way, like adding taste to water, or giving like products like oral aid. So water intake depends on a variety of factors in cats, including body size, temperature, the moisture content of food, as I said before, and any concurrent diseases. So obviously chronic kidney disease, diabetes mellitus, etc., will increase the water requirements in cats. So increasing water intake in cats with FLUTD includes the following measures. So they need to have free access to water at all times, and it's ideal if several sources of water can be available. So that may include different water bowls, water fountains, etc. Some cats like to drink water out of glasses, for example, rather than out of a water bowl. Adding broth or water to food, and here I think oral aid is a excellent product rather than having to mix a broth yourself. This is a very palatable solution that's easy to administer to cats. And by providing moist food, so wet diets, and as I said, water fountains as a source of water, as some cats prefer water in movement or running water. So the goal therapy of increasing water consumption is to maintain the urine-specific gravity less than 1040. Now we're moving on to talking a bit more about chronic kidney disease in cats, which is another indication for oral hydration therapy. And as opposed to feline lower urinary tract disease, which affects mainly younger cats. Chronic kidney disease is a disease of the older cat, and it's particularly common in cats above the age of 10. It's also a very common, or it's quite common in general veterinary practice. Approximately 4% of cats presenting in general practice. It's much more common, as you can see, in older cats above 10 years of age. The numbers are much higher, nearly 30 to 40% of this population. And it's the most common cause of death in cats over the age of 5. Most often the underlying cause is not known, as most cats are presenting with end-stage disease where the insulting cause cannot be determined. So this means that the management of these cases is ending up being much of the same. So first, the definition of chronic kidney disease. In humans, chronic kidney disease is defined by a sustained reduction of GFR, so glomerular filtration rate, or evidence of kidney damage for longer than 3 months duration. In pets and in dogs and cats, or this is the definition for cats, we look at the creatinine. We use creatinine as a marker of kidney disease. So a creatinine level of above 140 micromoles per liter in combination with a urine-specific gravity less than 1035. And this should be sustained over weeks to months to call it chronic kidney disease. In earlier stages, there may just be a dilute urine. This is more difficult to diagnose as it's often not associated with a lot of clinical signs either, other than possibly PUPD. I want to refer to iris staging as this is the system we are staging both dogs and cats with chronic kidney disease. The IRIS webpage, there's a lot of information about diagnosing, staging, and treating chronic kidney disease. Excellent information to look up. So other definitions, chronic kidney disease, there may just be structural changes or also persistent renal proteinuria. I'm not going to talk more in detail about renal proteinuria, but it's obviously important to rule out pre-renal and post-renal causes of proteinuria. And it could also be a persistent or substantial increase in creatinine from baseline values if you have, say, blood samples from the same patients over a certain time. So the aims of therapy for chronic kidney disease in cats is mainly supportive and symptomatic. It's focusing on improving the quality of life, first of all, and this is particularly important for more advanced stages of kidney disease, which tends to carry more clinical signs or be associated with more clinical signs than earlier stages. But also the aim is also obviously to slow the disease progression where possible, and this is more likely for earlier stages of chronic kidney disease. So the current guidelines on evidence-based management of chronic kidney disease in cats are from Journal of Feline Medicine and Surgery from 2016, so they're really up to date and new. So I've based the current management strategies on these guidelines, which I also want to refer the listeners to. Also, I've been looking at, obviously, or are referring to Irish recommendations. So what I like about these guidelines is that they are clinically prioritized rather than looking at where is the strongest evidence. So it's more sort of clinical opinionated. And in these guidelines, the first sort of goal is to maintain hydration, so hydration support. And the next step is dietary management, and then we have a number of other additional management options for hyperphosphatemia, hypokalemia, hypertension, etc. That I'm going to just mention very briefly. So the potential benefits of improving hydration in the cat with chronic kidney disease is to improve the overall quality of life. And in my experience, definitely the cats that are able to maintain their hydration levels to adequately do have much better quality of life. And do seem to cope with the disease much better. So another possible benefit is slowing disease progression, as dehydration may compromise renal blood flow and thereby cause further kidney damage. It may also improve electrolyte and acid-base disturbances, which is fairly common with chronic kidney disease, and help diluting uremic toxins. So the way to achieve proper hydration is obviously having free access to water at all times, and again have a variety of water sources available, and that includes flavored water. And again, I said before, this is where oral may be beneficial, because it's obviously sort of a ready-made product that has a taste that most cats really like. I want to mention that, and in terms of introducing oral aid, it's probably beneficial to wait introducing this to home surroundings rather than in an hospital environment, because as we do with renal diets, it's really important to try and do sort of gradual, slow introduction in order to increase the success rate for the cat accepting this taste. And I think it's, in my experience, cats are more likely to accept new diets when they are in a home environment. So wet diet is obviously also a way to increase the hydration or the fluid intake. So the oral approach is definitely preferable, and ideally it should be voluntary. And this was the way I mentioned before. It could also be via feeding tube, which may be a management options for some patients, where you can both provide medicines and food and hydration, give hydration via. Obviously, it's not a great long-term solution, but there may be specific cases where this is a possibility. Intermittent subcutaneous fluid therapy is recommended by some veterinarians. I think it's a case-by-case evaluation. And also certainly owner commitment, etc. And some cats with sort of a uremic crisis may, or just dehydration due to inappetence, etc., may need hospitalization for intravenous fluid therapy. So the renal diet is obviously the mainstay therapy in cats with chronic kidney disease. There are quite good evidence in cats with chronic kidney disease that renal diets have been shown to reduce clinical signs of uremia and to significantly prolong survival. So there's a strong indication for its use and this is why in cats with chronic kidney disease, and this is why it's really important to introduce the diet slowly and really put an effort into getting cats to eat the diet. Renal formulated diets are restricted in both protein and phosphorus, but there are also other features, including increased calorie densities, sodium restriction, potassium supplementation, alkalization, and supplementation with B vitamins, antioxidants, and omega-3 acids, which are all beneficial for the disease. So other available therapies for chronic kidney disease include antihypertensive agents. This is to prevent target organ damage, as hypertension in itself is not a risk factor for progressive renal disease in cats, as has been proven to be in dogs and humans. But obviously we want to prevent target organ damage, and this is particularly the eyes, so ocular damage, which we want to prevent. So management of proteinuria, I think what is important here is to make sure that the cat is really truly proteinuric, that it's renal proteinuria, that it is at a certain level to make treatment or management indicated, because there's no evidence to show that treatment improves survival. However, the degree of proteinuria is associated with survival in cats with chronic kidney disease, but it's not known whether treatment of the proteinuria actually improves the survival. And I think that's an important point to remember, as it always will be a great commitment for the owner to medicate the cat on a daily basis, and all the sort of veterinary follow-up, etc., that is associated with that. The last point here is management of inappetence and nausea and vomiting, as this is obviously a significant quality of life concern, and it may result in protein and calorie malnutrition. And studies documenting, there are studies documenting the effect of mirtazapine and meropetent in cats, whereas there are poorly documentation for uremic gastritis in cat, which means that anti-acid medications may not be indicated or may not be that helpful in cats as a treatment for inappetence and nausea. Other therapies, bacterial urinary tract infection is relatively common. Definitely culture the urine if there are pyuria and sediment examination, or if there are signs of lower urinary tract inflammation. But whether routine cultures should be performed or not is controversial. I think most clinicians do it currently, because we're worrying about the risk of ascending infection if we're leaving a subclinical infection. However, there are currently uncertain significance of subclinical bacteria also in cats with chronic kidney disease. And management of anemia is something we need to consider if it's severe enough to be clinical significant. So chronic anemia, mild non-regenerative anemia, is quite common in cats with chronic kidney disease, but may not be to an extent where any treatment or management is needed. So to end this webinar, I'm just going to briefly go through a few other indications where oral aid may obviously be a benefit, and this includes where oral hydration and the use of oral aid may be a benefit, and this includes acute kidney failure. In these cases, there's often risk of fluid overload in cases where the cat has inadequate urine production. So with oliguria or anuria, the fluid balance can be quite tricky to manage, and in these cases management with oral hydration is preferably rather than intravenous fluid therapy. This obviously doesn't include the very sick cases, but on the sort of way to recovery from acute kidney failure, introduction of oral hydration therapy as soon as possible is really a benefit. Um, Another condition, congestive heart failure, also a condition where we're worried about a fluid overload. We know that we are purposely dehydrating these animals with diuretics, and I think introducing or trying to increase the oral intake of water or fluid is really important to improve the quality of life in these cases as well. So this was all I have for tonight's webinar, and I want to thank you all the listeners, and I'm happy to answer any questions.
Excellent. Thank you very much, Christine. We actually just have the one question from a listener. So you've obviously done a very informative presentation and answered everybody's questions already. So I'll just put this question to you. Are you saying that reducing proteinuria may be an unhelpful clinical goal if it does not translate into increased survival times?
Yes, I think we definitely do not have the evidence that it's beneficial in terms of being protective for the kidneys or to slow progression of the disease. And I think that's often what people associate treatment with, for example, ACE inhibitor therapy, is that you want to slow progression of the disease or ideally improve quality of life. And we do not have the answer to whether this is actually the case. So in my opinion, I think it's really something that shouldn't just be a treatment that shouldn't just be started on every single patient where you are documenting proteinuria. First of all, it should be repeated proteinuria, so at least documented on 2 separate occasions with a few weeks apart. And then you should also look at the level of proteinuria. So I think our current sort of limit where we'll start treatment is 0.4, but I think definitely where we have a gray zone in cats between 0.2 and 0.4, I think definitely is having above 0.4 on several occasions, and I'm talking about the UPC ratio. So yes, it may not be beneficial because we do not have the evidence to say that it is in terms of increasing survival. And yeah, I think that's as much as I can answer this question.
Perfect, thank you. We've actually just had a few more questions pop up, so I'll go through those as well. Are there any contraindications with using oral aid, i.e. hypoallergenic or anything else that you should be aware of?
No, not as I would say. There is it is a hydrolyzed protein source that is it's a chicken flavored and hydrolyzed, so it can be used for patients on a hydrolyzed diet. So for example, patients with IBD or atopic dermatitis. And no, not really any other indications or contraindications.
Okay, yeah, thank you, thanks. And would you recommend nandrolone injections for weight loss or inappetence?
Yeah, nandrolone is an anabolic steroid, and I know I do not have any personal experience using it. I know it's been used a lot in the past. It's not an ideal way of increasing the muscle mass of the cats. I think what we should we do not, first of all, we do not really have any studies to suggest that it's beneficial, and we do not know what sort of consequences it has long term for the cats. And I think the main focus should really be on maintaining the body condition of the cat by maintaining the cat's appetite, decreasing any clinical signs of nausea, etc., and feeding the right type of diet, so high calorie content, high quality protein, etc. I think that's all.
Thank you, thanks. And I've just got one final question for you, Christine. In all the patients that you have used Oralade on, how successful has the therapy been to increasing fluid intake and helping appetite? And have you got any particular case studies that you could use as an example?
Yeah, I have. In my personal experience, I think that it's more likely that cats with lower urinary tract disease will drink it, as these cats are often healthy cats and not in appetite, not do not have nausea, etc. Like cats with chronic kidney disease often are more difficult to manage in terms of getting them to eat or drink certain things. So my personal experience is that it's more likely that cats that has a resolved episode of FLUTD will drink all eight quite voluntarily. I can't really set exact numbers on that, but I think my personal experience, at least 2/3 of the cat has been successful, whereas chronic kidney disease cases, I think it's more a 50-50. But it's definitely worth giving it a go. Yeah, I think that's it really.
Perfect. Thank you, Christine. Okay, well that's it for questions. And I'd just like to remind everybody that any questions that haven't been answered that have been submitted will be answered via email after the webinar has been finished in the coming days. If you have anything that you would like me to put to Christine after this webinar is finished, please feel free to email your questions over to me as well. You can contact me at hsanimalhealth.co.uk. So that's rachel.cook@hsanimalhealth.co.uk. I would also just like to remind you that we also have a current promotion for Oralade Cat for the 150 milliliter bottles. This is on a special offer of buy one, get one free at the moment. And we've been promoting this to practices via emails and flyers as well. So keep an eye out for that. I think that's our time just about up. So I'd like to say a really big thank you to Oralade for sponsoring this Henry Schein webinar. Also to yourself, Christine, again for presenting and for fielding questions so well. And finally to everyone who has given up their Wednesday evening to listen along live tonight. I hope you found this really helpful and informative. And feel free to listen again using your registration details to log in. This webinar is going to be available for those of you who weren't able to catch the start or want to listen again at any point for a full year. So feel free to take advantage of this and let others know. And keep your eyes open for more Henry Schein webinars in the coming weeks. Okay, thank you and good night.